Welcome to Transforming and Thriving
with best friends Brooke, Stacie, and Neelia.
Podcast dedicated to women sharing their inspirational stories.
Hey there, everyone. We are so excited to be back. I'm Brooke.
And I'm Stacie. Today, I have the pleasure of introducing a woman who really represents resilience and strength, Chelseah Darling. Chelsea's a physician assistant and a strong single mother to a 6-year-old boy. She had a recent life-changing experience that indirectly led me to meet her, as during that time she was taking a hiatus from her career as a result of it and spending time walking dogs to heal her mind, body, and soul. And what could be better than spending time in nature with animals? She was the most overqualified dog walker I've met, who walked our dog Kai and also helped out with sitting our toddler boy. I will let her share in depth with listeners in her own words, but it's inspired her to find ways in which she can utilize her experience to help inspire hope in other women who are dealing with challenging life situations. I personally asked her to be a guest on this podcast when we first created it, since I knew her story would touch so many who had the honor of hearing her share it.
Thank you so much for being here, Chelsea. How are you doing today?
I'm good. Yes. Thank you so much for having me. And thank you, Stacie, for the wonderful introduction. Yeah, we did through my journey. It's kind of how we met when I was trying to heal. So it is wonderful that I was able to now come on this podcast to share my story and hopefully inspire others out there with some hope when you are going through a hard time.
Well, I'm definitely looking forward to getting to know you more and hearing more about this inspiring story that you're going to share today. Can you start off by sharing what this major event was for you? What happened?
Yeah, so my major event, which led to a transition in my life, was being diagnosed with acute myeloid leukemia. And that happened May of 2023. So, I had been healthy my whole life, never had issues, never ever thought like my health would ever be a major issue, especially at 37 years old is when it happened, and it was just kind of out of nowhere. I had gotten sick and I hadn't really gotten better, like kind of felt better, but I didn't feel 100% better. My energy wasn't back. And I kept getting a sore throat. And I kind of thought, gosh, is my mono coming back? And so I was at work one day and I was like, gosh, I feel out of breath. I feel anemic. And so I was like, and I work in medical. I work at dermatology. So I had one of my medical assistants. I'm like, why don't you draw my blood? Just want to check, I hadn't had a CBC done in maybe a year or so. And so she just went and checked them. And then the next day the results came in and they were very alarming. Like they were even calling our clinic nurse because I was like critical white blood cells. I was very anemic. My hemoglobin was like 7. My platelets were like 50. And so clearly that was very shocking. And that kind of just led me to be like, okay, what do I do next? And I immediately went and saw a hematologist who told me this could be a viral thing and it could be just suppressing your bone marrow. And so I was hoping for that. And they're like, but, we can give you something to increase your white blood cells. Because I really had like no immune system. So I was really, really at risk for infection. He was basically saying, if you get a fever, you have to go to the hospital and get IV antibiotics. Because it's like when you're that neutropenic, it's kind of a medical emergency and you have to be admitted. So there was this waiting period to getting a bone marrow biopsy to see, if he had to rule out leukemia in order to give me this stimulating, factor for my bone marrow to produce more white blood cells. And so during that time, I was just kind of like waiting. I had an HMO insurance at the time, so I couldn't go right in and do it, waiting for authorization. I had a really, really great doctor, though, and who actually, the doctor I was working for, she recommended him, and she was really, my boss at the time, she was very, very helpful in, helping me through this too, and getting me connected to doctors. And so he had suggested, he's like, you know what, just drive to the hospital, and I'm on staff, I will just admit you. And that way, even though we don't usually admit for stuff like this, and then we can just do the bone marrow biopsy. So drive to the hospital, to the ER, go in, to get admitted, and then they do my bone marrow biopsy, which I was terrified of doing. So I've heard they were very, very painful. So I was really nervous, but actually it was not so bad at all. It was actually way easier than I ever thought it was going to be. They gave you gave you some meds, and they numb you up. So that was my first of 10 bone marrow biopsies I was going to have.
Oh my gosh, 10? That's so much to go through. I'm really glad that it wasn't at least as bad as you thought it was gonna be.
You go from thinking you're normal to now I'm at the hospital admitted. And then the doctor calls me that night and he's like, okay, well, we're seeing some blasts come through. He's like, that could be your bone marrow is coming back, or it could be that you have leukemia. And I was like, oh, great. And so I'm thinking, come on, I can't have leukemia. Like, totally not something on my radar at that time. And so, I wait that night. And then the next morning he comes in. Right before he came in, I remember getting nauseous, feeling like something bad was going to happen. I threw up actually. And then he comes in the room and he does tell me that I have leukemia. And I was like, oh, and I was devastated, obviously. And I was like, okay, what kind? Because there's different kinds of leukemia that you can have. And I was like, okay, what? He's like, it's acute leukemia, it's acute AML, which is basically like the hardest cure rate out of all of them. So being in medical, obviously I know that. So I'm like, okay, this is like not good. Hearing that, and well, my son had just turned 5 at the time. So I was like, how am I going to be there for him? You have all these thoughts going through your head because being a single mom, it's like I supported him and worked. Now I can't work. I can't do anything. I'm in the hospital with like no blood basically in my body, no immune system. And so he keeps me in the hospital for a week just to see if I can get transferred. When you have leukemia, you have to go immediately into treatment because it's very aggressive, because it's basically your bone, you don't have red blood cells, you don't have white blood cells, you're not producing platelets. So I had to start getting transfusions. I had to get a red blood cell transfusion, then you get platelets. So the first treatment is they put you in the hospital for 4 weeks. They do an induction therapy, they call you. So they hit you with really hard chemo and wipe out your bone marrow to wipe out the leukemia. And, 90% of the time you'll go into remission. And that's the goal, is just to keep you in remission. But you have to stay in the hospital so from that night that I went in to do my biopsy, I was in a week waiting to get transferred, but I wasn't getting transferred. So I went home a day, and then I went back in to UC Irvine again as basically an emergency to be admitted. So it was just kind of like from like being normal to like now you have to be in the hospital I was there for 5 weeks. So it was really hard, and it was hard. I'd never spent that much time away from my son. So that was really weighing on me. Like the longest I think I'd spent was 10 days away, for a trip. So I was like, okay, you worry.
Yeah, 5 weeks is a really long time. That must have been really hard to be away from your son that long. What were the next steps in your treatment journey then?
So then you go in and you have to get pretty intense chemo. And so the chemo basically drops all your levels out. So it's a little scary at first because, you wake up and they do your blood work every morning and they're testing, and it's like white blood cells, 0.1. So it's like you're weeks with 0 white blood cells. So that gets, it's just nerve wracking. You feel very fragile throughout this whole process. So luckily I did really well and I made it into remission that first month, that first, induction chemo as they call it. And so after 5 weeks in the hospital, I was able to go home, which is good. And my blood counts had come back up and I was in remission. So that was good. I had kind of this semblance of, okay, I can feel a little not so vulnerable, I can go out in the world and, not get infections. They're really worried about you getting infections. And a lot of times when you're in the hospital, you get infections. And I was very lucky I did not get an infection. So from there, I had to do 2 more rounds of consolidation treatment, which is not as intense for the chemo. I was able to do the one outpatient, but it still is involved. They still drop all your counts. And after you do the chemo, you have to keep driving back and getting platelets and blood, and you still have no immune system. So you kind of live in this very fragile, vulnerable state. You got to be really careful not to get an infection, not to get sick. And
Which
then
has to be hard when you're a single mom
Yes,
and you have a
exactly.
child
Yeah.
who's in and out of school and
Yes. So it's kind of like so I had to kind of wear a mask around him, always be careful. I mean, I really did luck out because I really didn't get much more than a cold during this time. And a lot of people end up having to go back into the hospital and treat infections. So I really stayed healthy. I did a lot of other stuff. I did integrative medicine. I went to a integrative cancer center and did a lot of IVs and a lot of things just to keep me strong. And also that helped my mentality, I think, knowing that it helped my mental state too. I think knowing I was doing something too to support and build up my body. Because otherwise it kind of drags your mind into this kind of just fearful place. And kind of you're living in fear of catching something, or your counts are going to get too low and you're going to get an infection. So it's just kind of, yeah. And with a kid, it's hard. It was definitely a hard time in my life. So then I did one more round of consolidation, which this one I had been going up to City of Hope, and he wanted me to do something a little more aggressive. And so he did hospitalize me just for a week for that one, because he was preparing me for what would ultimately be the end of my treatment, which was a stem cell transplant. And that's a pretty invasive process. But, if it works, it's the cure for your cancer, basically, so it won't come back. I mean, even though you still have to be monitored, but it's the best way to prevent it from coming back. And they determine if you need it based on like the genetic markers of your cancer. And so mine had genetic markers, which was more high risk. And they said, well, you're young, you can do this stem cell transplant. I mean, I was very, very hesitant. That was like my one fear when I first started. I did not want to have to go through that, because I just knew how hard it was going to be. And there's a lot of risk involved, a lot of side effects.
What's involved? I don't know much about it. Can you share?
So what they do is first of all, they need to find a donor for you. So they need to find someone that basically there's HLA markers that are markers for your immune system that recognize that this is you, that this is my body. Okay, so we're not going to attack this body. There's different levels of people that can match you. And so they check both. I have two sisters, because he said a sibling donor is the best. Both my two sisters were only a 50% match for me. And so that wasn't ideal. They then go into this there's a international bone marrow registry that is basically people from all over the world. Other countries are a part of this. And so they can look into it and see if you have any matches by, swabbing your mouth, testing your DNA. And so I did have actually quite a few matches, because there's a lot of people in Europe that, like countries like Germany and the UK, they have a huge donor program there. And if you're of European descent, you're of luck. So I did have a match. And so it was a 24-year-old male from Europe. I can't find out anything about him other than his age. And then I know he's somewhere in Europe. So I can't find out any more information from him until the 2-year mark. So we have written letters back and forth to each other anonymously. I gave him a thank you letter, and then he just recently wrote me back, which was really nice to hear from him. So, because it kind of makes the whole process and him seem more real and feel more connected with him. But anyway, so the start of that is they find you a match, and then once they find this match, they get him, all tested and make sure he doesn't have any transmittable diseases and he's a candidate. And so once he passes all his tests, then you kind of get a date going for when the transplant's going to happen. And so the transplant, mine was October 20th, and then they have a whole protocol that you go through. So you have to do a pretty intense, what would they call, a conditioning protocol, which is where they give you really either high doses of chemo and radiation, or just radiation and chemo, combination of something to kill off all your bone marrow. So basically you're going in and destroying any part of you that is bone marrow. And then what they do is then after you go through that process, they infuse you with the new stem cells from the donor. So then that repopulates your bone marrow, and you basically have a whole new DNA immune system. So now all of my blood is his blood, and essentially, because I no longer have my own DNA of my blood, in a sense. If I were to get a blood draw, it would be his XY male blood. So it's really an intense process. I was in a clinical trial, and they did just radiation to me, my whole body. So they radiated all of my bone marrow. It was actually called total lymph and bone marrow radiation. So it was a little less than my whole body. So they targeted it. And that was pretty hard to go through because you have to lay very still in this radiation chamber with this mask over your head that's really tight. You cannot move. And you have to lay there for almost 40 minutes while they scan your body and then they radiate.
Wow.
And you cannot move. It was pretty like anxiety ridden. I had to take something before to kind of, because it's just you can't move a bone, and then the machine goes. I would say that was probably the worst part, like worse than getting chemo, because it's like you hear this noise, this kind of like metal smell. It feels, and it's just kind of like this traumatizing feeling, honestly. And
Sounds like, yeah.
if you're claustrophobic, forget it, because they tie you. It's like they cage you down, so you
Mm.
can't move your head or your neck or anything. It's this plastic thing that smushes your whole face. So I had to do that twice a day for 5 days. And it makes you sick too. You get really nauseous. You don't feel that great. And so during that time, it's killing off all your bone marrow. And then on day 5 hours after your last radiation, they come in, they give you this new man's stem cells. And that's easy. That's just like getting a blood transfusion. And so then you just are, in this whole time, you have to be in the hospital and be isolated. And there's a transplant floor, and you cannot go outside. You can't leave the floor. You can't do anything because now your immune system's completely taken away. So you have no immune system basically at all because they just killed it off. They're just giving you platelets, transfusing you with platelets and red blood cells to keep you going, but you have no immune system until these new cells go in and start to make you a new system. So there's this like waiting period of, I don't know, maybe mine went pretty quick. Like they're like, I want to say in less than 14 days after the transfusion of the stem cells, I started to make some white blood cells. So that was good. You know, you have to take prophylactic antibiotics, but you're not allowed to leave even the hospital floor. Like my other hospital, I could go outside sometimes. It was nice, but this one, it was hard because you don't feel the greatest at all either. So it's quite a pretty anxious journey because you're in the hospital and going through the treatment. You know, I get the radiation. You do chemo after that too. After you do the radiation, they give you the stem cells. They give you 2 days of chemo that's supposed to help what's called GVHG, because that's also something you're worried about, which is called graft versus host disease. And that's basically these new stem cells can now start attacking your body. It's not your technical body. So you're also on immunosuppressants during this time, a very intense drug called tacrolimus, which can cause a lot of adverse effects. Doesn't make you feel the greatest, but that you kind of need to take it for a little bit while the new immune system comes in. It's suppressing, so it's not coming too much and going after and attacking your cells. So it's just a very, very anxiety ridden period because you're worried, am I getting an infection? Because you can die from infection, then you can die from GVHD, then, which is if it gets real bad and really attacks basically the digestive system, you can become very sick and not make it. So you kind of just have all these factors. You're taking a lot of medications. So I was in the hospital with that I was probably only there 3 weeks. And then they send you to the hotel next to the hospital on campus. So I was able to go to the hotel, but you have to stay at the hotel till the first 100 days post the transplant, just for risk of infection, and they're monitoring you going in twice a week for blood work. So it was hard to, obviously, and you have to have a caretaker with you for the first 3 months. So my mom and my sisters came out and kind of alternated with that. But yeah, so I made it through all of that.
My
And
goodness. Sounds like such an intense process, and not to mention really isolating. Periods where you had to stay in the hospital and be away from your son, you mentioned earlier, for periods of time, and just your network of people. Obviously, you mentioned you had your caretakers during periods of time, but you didn't have your community around you due to risk factors. So that must have been really hard. I'm so thrilled to hear that it sounds like your treatment was successful, but you went through so much, so many steps. I have actually heard about the bone marrow registry. I actually am on the registry. I've had several people in my life impacted by leukemia, and it's a wonderful network. And science is amazing. All the
Yeah,
treatments, I'm so sorry you had to go through all of the intensity and just pain and all of the things that come with it. But the advancements that have been made in science are truly incredible. So I'm so glad that you're here and
and
we're able to move through all of that. We will definitely be sharing in our show notes the link to the registry. I think it is such an important thing to spread awareness about. So it was formerly called Be the Match. Some people might be familiar with. And it is now called the National Marrow Donor Program. And it really is a way to register to help those who don't have a suitable match within their family. So that is something to consider. So, was there anything that in particular kept you grounded when you felt like things were uncertain or really difficult?
I think, yes, I want to say my family and just knowing like I had to be there for my son. And, even just between treatment periods, I think being able to take care of him and just be with him has helped to normalize things a little bit. It would take me away from the reality I was in. So I think that helped keep me grounded.
Yeah, that makes total sense. I could see with so much uncertainty and worry how a routine can give you this anchor in normalcy.
Yeah. I also am pretty spiritual, and so prayer and meditation and that was really a huge factor in getting me through this.
So, what were things like after treatment for you?
After, so I mean, even like during the treatment, going through the treatment, that was the hard part. But actually, what was even harder for me was like there was this post period once you were done with treatment that you thought, okay, I'm gonna be good, or I'm gonna feel good, or be happy, or whatever it is, be relieved. But to me, they didn't tell me about this, that this was going to happen, but apparently I've talked to other people, and it definitely is a thing that happens. You get this really bad anxiety and depression that comes after everything. And that is what hit me really hard and was very hard to get through when everything was said and done. So that, because you're during treatment, it's almost like I got put into a different air, within my head, my mindset about myself and the world kind of changed. And so then coming out and realizing, okay, am I going to be able to get back to life, be able to survive, and not live in this fear state? Because I was going through and I had talked to some therapists and people, they were saying, no, when you go through a trauma, after you kind of live in this state of fear. So I didn't really expect that to happen or really know what was happening to me. So that was really, I had to kind of get over that hump and get through that really kind of like bad depression I fell into after treatment. And that's when I did a lot of healing therapies. Like I did EMDR and yoga, meditation, prayer. That is what got me through that period. Just I did a lot of different healing modalities. So I don't know if that answers your question.
No, absolutely. That was very helpful to
Yeah.
learn, and you're very encouraging for other people to hear.
Yeah, absolutely. And what you were saying about just the anxiety and I mean, you went through a major trauma. So it's almost like there's a lot of PTSD that can go along with that. A lot of
Yeah.
those
Yeah.
anxiety, depression, and just fear because you were living in this whirlwind of shock and going through all of these things that just had such immediacy that had to happen, and all of these traumatic experiences, and everything was just happening so quickly and just such a huge 180-degree pivot in your life. So I'm so glad to hear that you were able to find so many things that helped you heal through that. Not only, your physical body, but like you said, the emotional piece of it, and doing EMDR and yoga and spiritual practices. I think, that's so important for other people to hear as well, that those things can be extremely helpful when you're in the middle of going through something like that. I'm wondering, what continues after that period? What has continued to help you to cope with like the anxiety, depression, or to even start feeling that you're moving to a place of resilience through it and finding even more strength and hope and inspiration? Are you still doing the same practices, or is there anything else that's been helpful, or any people in your life?
Yeah, I think that EMDR was very, really helpful. And I think also too, like going through that suffering that I went through kind of helped me to really kind of dig deep into my healing. I kind of reevaluated my past and my past relationships and what it is I needed to make more healthy, emotionally and in my life. So I kind of did a journey of healing in a sense and kind of addressed and touched on things even from my past that maybe I hadn't thought about that I needed to bring to the surface, and what changes I needed to make in my life, but that maybe I wanted to have made before I got sick that I didn't make. I remember, I want to say February was like a couple months before I really got diagnosed. I remember sitting with friends and being like, I really need a new life. This is what I had said to them. I was like, I just want a new change. I want to move to a small town. I need kind of a new beginning. And so even before I got sick, I knew I needed that. And so then after I went through this healing journey, that was a part of that inspired me to, when I was done, to really make a change. And that's when moving my life to Oregon and kind of becoming more aligned with what it is that I wanted helped strengthen me and help refocus me and move me away from my old bad patterns, the area of toxic people, toxic relationships. So a new thing for me too is kind of like really focusing on building healthy relationships and really focusing on community and those, building that. And I think that's really important because I think there's so many people on my journey of the healing through this, physically, mentally, spiritually, that helped me. There were so many different people I saw and different practitioners, and they all helped me in a small manner, but they all helped build me to where I needed to be. So it just kind of like reinforced the idea of how important it is that our community and our friends and our family, and that's really what I guess I want to focus on going forward, and also just building healthy relationships. So I guess where my focus is on these days. I was recently reading a book about healing, and so during my journey, I think when people are going through really hard times, we feel like we're suffering. And this book that I read, there's a whole chapter about when people suffer and how we can kind of get through that. And one of the things he says is suffering alienates us from our true self, the core of our being, wellspring, and our awareness and self-expression. But suffering exists so that we may learn to be free of ignorance and recognize our true nature as spiritual beings. So I kind of really liked how he worded that, because whatever your suffering is, I remember my friend, when I was going through my suffering and everything, she was going through a really bad divorce and she really had a hard time with that. And we were both in this kind of depression together in a sense, and we talked to each other. And then as she came out of hers and I came out of mine, I remember talking to her one day and she goes to me, "You know what? I'm just happy to feel like a normal human again."
Mhm.
And I thought, you know what? That makes sense, because after reading this, what he had said about suffering, really connected with it. And there's a lot of unknown that's involved with that, which produces anxiety. But through that suffering, I think it helps us to connect to like our new self, to have a new reality. And so I think that's why, even though suffering is really hard, that once we get through it, it helps to transform us, which is, what you guys' podcast is talking about.
Yeah,
So,
what a wonderful perspective after all
yeah.
you've gone through. Thank you for sharing that quote. It's really powerful. And that book recommendation, it sounds like it was really impactful for you and your friend. And what an incredibly brave and positive way to look at suffering. I've never heard it being looked at that way before. And we'll definitely put the link of that book in the show notes. I think that will be very helpful for other people taking suffering and using it as an opportunity to make changes in your life, that is really, really inspiring. Would you mind sharing what advice would you give somebody who's on their healing journey?
So I would say, I guess it sounds so generic, but things will always get better. Like, I remember going after I went through the treatment and everything, and even just the depression I had to get through, I remember feeling like, how am I going to make it through this? Like, I felt really bad. I was like, how do humans actually experience this type of depression? Like, that's where I was at. And I was like, this should not physically be possible. And so I felt like at points, like, is there a way through this? Like, am I going to be able to make it through this? And yes, I think that as bad as things can get, or as hard as they can get, there's always going to be a way through, and sometimes you just have to feel the emotions, get through it, and there is light at the end of the darkness. Yeah, and I would say too, don't hesitate to ask people for help. I would
Mhm.
say there's always people. We're all here to help and heal each other. So definitely reach out and utilize other people and other resources, because that's what they're there for. And they, even if it's like the smallest, someone's bringing you a meal, but everybody helps on a different aspect, but it all comes together to this bigger help, to bigger healing. So I think you were just all on this earth healing each other. So we have to keep that in mind with our interactions.
Well, Chelseah, I really want to thank you for coming on and not only just being so open and sharing your story and your journey through diagnosis, treatment, recovery, but also providing some extremely valuable advice and resources for listeners who may have someone in their life who is going through something similar, or maybe who have or are currently going through something like this. I think it can touch and impact so many people in a positive way, and really appreciate, I reached out to you and asked, I was like, hey, do you want to be on my podcast? And you're like, sure. So I just to close out, I just want to, thank you again. I really appreciate you being here. And
Yeah, thank you for
yeah,
having me. I appreciate it. I hope in some level this touches someone or helps them when they're going through a hard time. So
Yeah, thank you for being here, Chelsea. To all of our listeners, thank you for joining us on this episode of Transforming and Thriving. We'll be back every other Monday with more inspiring stories. Please follow us on your favorite podcast app and follow us on Instagram so you can be a part of this community and stay up to date with each episode. Feel free to leave a review so that we can get your valuable feedback and other people can find these powerful stories. We're all in this crazy life together, so let's move through it together. See you there.